Nursing school textbooks. They are long, they are boring, but are they ever helpful? That's what I'm trying to answer in today's video, so if that's a topic that interests you, then please keep on watching. Hey everybody, my name is Kat. I'm a senior nursing student in my last semester of nursing school, and I also work as a tutor at my nursing school. And one of the issues that I have kind of seen come up is, do we need to use nursing textbooks ever in order to succeed in classes? The short answer, at least in my opinion, is sometimes. It's not a straight yes or no, but during my time in nursing school, there are 3 factors or indicators that I have identified that tell me that, okay, I need to use my textbook for this one. So the first factor that I look at if I've already started the class is, okay, am I doing well in the class? Am I making the grades that I want to make? Because if that's you and you're not using the textbook, you're just going off the lecture, notes, PowerPoints, whatever, Quizlets, then congratulations. Keep going. Do not waste time with, a lengthy, dry textbook. But if you're not doing as well as you'd like, if you're not making those grades, then I would strongly consider making a change in the way you're studying and try opening up that textbook. The second indicator that you may or may not need to use your textbook is, does your professor have good PowerPoints and good lectures? Because some professors are amazing lecturers. They give you what you need to know in the lecture, and they'll tell you that. They're like, this is what I want you to know for the test. And you're like, thank you, because oof. But some professors, their lectures might leave a little bit to be desired. They might be kind of super dry, maybe a very anecdotal, which, can be interesting, but it's not really the most helpful. And their PowerPoints might be very vague. They might be very general with an overview, like chapter headings or whatever, which again, I don't think that's ever really that helpful. So in that case, that for me is a very strong clue that I am probably gonna need to open up my textbook in order to properly prepare for their tests. Because the thing about nursing school tests, and you might hear people say oh, you've never taken a test like this before, just wait and see. And that's kind of true, but just to sort of explain why they're different from any other test you've taken before, is that the questions are largely, and especially as you progress through nursing school, largely application-based questions. There are some that are just pure fact, what size needle do you use for this thing, whatever. And you're just oh, it's this size. But a lot of times they're asking you things about clinical judgment, about prioritization. And so you need to take the information you've learned in class, hopefully, and then apply it to answer the question properly. But the problem that I see and the deficit that often exists is that professors do not necessarily always give you the information, that foundational knowledge that you have to take these tests. They don't give it to you. And so students go in and they're trying to answer application-based questions using knowledge that they just don't have. So it doesn't go very well. So you really need to, one way or another, make sure that you are getting that basic foundational knowledge. And like it or not, the textbooks have it. They might not have it in a way that's super easy to learn or to read, but they have it. So if you're not getting it in class and you recognize that, then you really, I think the best option is to open the textbook. Of course, there are other options. There's a lot of great videos out there that go over, so many nursing topics, and those can be quite helpful. Practice questions are always great. But I do think the best, the strongest performer is still going to be your textbook. Okay, so my third and final indicator, clue that I might need to use the textbook it has to do with study guides. First of all, does your professor even give one? I hope they do, because I've had ones that don't, and it's just always tricky to prepare for those tests because you really don't know what they might ask. But if you know, because you've had them before, or maybe you know somebody who's been through their class already, you know that they give study guides that are truly representative of what will be on their test, then that can be a good sign that maybe you don't need to use a textbook very much, because if you can look at that study guide and look at your notes that you've taken on their lecture and, you know, they match up, everything on the study guide is in the notes, then you can probably just go off your notes, go off their lectures, and you will be prepared for that test. However, if they don't give a study guide, or if they give a study guide that again is just very like general, it's kind of like an overview of just everything you've talked about, that can be a sign that maybe I need to look at the textbook to make sure that I have the depth of knowledge that I want on all of these topics. Again, it can be helpful to, like, if it's a vague study guide, it can still be kind of helpful to help you narrow down where you need to look in the textbook. But you'd probably be better off opening up the chapter and reading through it, and maybe even taking notes off the chapter or highlighting the areas that seem really important. So again, those are my 3 indicators that you probably need to use the textbook. And I would say, honestly, if in doubt, open the dang textbook. Like, it's, yes, they're long and boring and all of that, but you know, we want to get through nursing school. We want to succeed and become amazing nurses and take care of people and have wonderful careers. So if it means, you know, wading through all of the extra stuff in the textbook and the chapter in order to make all of that happen, then I do think it's totally worth it. So like I said, if you're in doubt, try the textbook, and you know, I would say it probably won't hurt, you know, whether it helps or not, it depends, like I was kind of talking about, on a lot of things, but it probably won't hurt. So it's always a good option if you haven't tried that yet and you're not doing, you know, as well as you'd want, open the textbook and see what happens. If you enjoyed this video, please consider subscribing, hit the like button. This is my first video. I had a lot of fun making it, and I have a lot of other ideas for more tips and tricks about nursing school, informational type videos. So if that's something you would be interested in, please consider leaving a comment, letting me know, you know, what topics you would like to hear about. That's all I've got for today. So I hope you guys have an amazing day and happy studying. Bye. So please hit the like button and consider scribing. I can't speak anymore.